It's a month filled with a whole lot of awareness we need to create. And for me, most times, if you ask me the other name for October, I would say it should be named the month of the ribbons because you see lots of ribbons around purple, red, pink, you see, and then it's all for different causes as regards a human endeavor and how to make us live healthily, most especially. But for us this morning, we'll be turning our attention to something that is related to everyone would know someone who should know someone who's gone through this because of the awareness out there. So this month is the awareness for breast cancer. That is what it's all about. But hey, you don't need to run away just yet. Just stay there. You would find out as this conversation gets on. You will see the reason why you should stay tuned and stay very close to your radio because my guest is waiting already. I'm talking about Dr. Anne Olowu. She's here, the public health physician, principal consultant at AnneAide Consulting. Good morning to you.
Good morning. Thank you, Matt.
Okay, so welcome. We just need you to approach the mic a bit and then so we
Okay.
can get every information as it ought to be this morning. So, for starters, October is Breast Cancer Awareness Month with the theme Thrive 365. That's what it is saying here. So, according to a recent Professor Millicent Obajimi, Professor of Radiology at the University of College, UCH Ibadan, it said the leading cause of cancer in women worldwide has continued to rise in Nigeria and now accounts for about 23% of new cases of cancer. These are, very frightening kind of stats we will get. But before we get to why it's on the rise, please help the listener understand right now what exactly are we talking about when we say breast cancer? Or probably let's begin with what cancer is, then we zero in on breast cancer.
Well, thank you, Masha. So, cancer really, when we say cancer, what is cancer? It is the abnormal growth of cells that are supposed to have died. So, we know that our bodies regenerate every day. Our bodies have cells, that regenerate. Some of the cells die off and the new ones come about. Now, in the regeneration of cells and the production of cells by the body in different parts of the body, and sometimes we have abnormal mutation of cells. That means that I think that just generally means that cells that are bad, that were not well formed. So ideally, these cells that are not well formed are supposed to be absorbed, die, and then be absorbed by the body through the lymphatic system and the other systems, the immune
Mhm.
systems, and all of that. But unfortunately, some of these bad cells do not die. So they continue to grow. And when they continue to grow, they prevent the production of new healthy cells. And because they are bad cells and they are growing, so they are feeding on the other cells in the body, in that part of the body. So in this case, breast cancer, those bad cells are growing and mutating in the breast tissue. And if they are not arrested or stopped or detected early and something done to them, they then continue to grow. And they then go to what we call metastasis and can go to other parts of the body and spread to other parts of the body. In the case of breast cancer, usually metastasis or spread of the cancer from the breast can spread to the brain, it can spread to the bones,
Mm.
it can spread to the liver, and it can spread to the lungs. Those are the usual areas that breast cancer cells spread to, and so that is what cancer really is, and in this instance, what breast cancer
Okay,
is.
so we'll take it also from this elaborate conversation, the intro submission you've made. There are other kinds of cancer, but our main focus here is
Possibly, yeah,
it tells you it's breast cancer.
yeah.
So as we get on the conversation, let's quickly also establish this before someone again listening might just want to say, okay, it's breast cancer and it seemed like it is tilting already. It's a woman kind of conversation. So please leave me out of this WhatsApp group. Help us understand this. Breast cancer, is it really something that should just be the concern of women alone or a situation, a health condition affecting just women because we think women, breast is about women and we leave out the men?
Thank you. We were discussing just before the show started, and we're talking about why it's an important issue for both men and female. First, let us talk about the fact that we all have women in our life. We have our mothers, we have our grandmothers, we have our aunties, we have our cousins, we have our nieces, we have our friends who are females, we have daughters, we have sisters, we have wives. So, I mean, we know that in one form or the other, breast cancer affects us. Now, breast cancer is not only limited to females. Males have breasts as well.
Okay.
I recall discussing with a group of people, young people, and they were aghast when I said men have breasts. I'm like, yes, men have breasts. It just doesn't develop because the hormones that make the breast develop in women are restricted in men,
Yes.
and so males have breasts too, and so are also at a risk of developing breast cancer. However, we know that 99% of breast cancer cases occur in women, but up to 1% of breast cancer also occurs in men. And because a lot of people are not aware that breast cancer occurs in men, a lot of times breast cancer found in men actually is found too late.
Okay.
And so we have breast cancer deaths occurring also in men. So it's an issue. Breast cancer is something of concern for both males and females.
This would lead us to the conversation of the symptoms in itself, because now you've established the abnormal growth of cells around the breast area and all the issues around it, and then that leads to metastasis that you talked about uncontrollably, and then it becomes a problem spreading to other parts of organs of the female body, or even if it's found in a man. Take us through symptoms now, how it manifests, and then let's see how we can begin to pay attention and start from
Okay,
there.
so the symptoms and signs of breast cancer now, that's what we're talking about. Now, the most common symptoms that people present with, it's a lump in the breast. A lump means simply means maybe like it's a mass. It's something that you feel that you know that is not usually there, that wasn't there. It's not part of the breast structure. When I mean the breast structure, it's not part of the ducts. It's not part of the lobules. The lobules are the part of the breast that actually produce the milk. The ducts are the like the vessel that the milk comes out during breastfeeding. It's not part of the fatty deposition in the breast. It's just a different type of mass that people feel. And we will go on to talk about how to detect that later on. But usually we find that lumps are the most commonest signs or symptom of breast cancer. That is not to say that people who have breast, it's not everyone who has breast cancer feels a lump. Sometimes you don't feel any lump. Sometimes the lump or the mass is discovered um, radiographically, and we'll get to that. But having said that, the most common symptom that people usually find is the lump. Now, aside the lump, we then go to the shape of the breast. Usually, when there is a problem in the breast, you will find when we have two breasts. Sometimes you may find that the shape of one breast is different from the second from the other breast. So maybe there may be a breast distortion,
Okay.
the shape and the size, there may be breast distortion. Now, around the skin around the breast
Yes.
may also change. The color may change depending on your skin color. It may change. There may be darkish discoloration, purplish discoloration, reddish discoloration around that area of the breast. There may be swelling, so I mean around the breast. We may make it also look bigger than the other one than usual. There may be flaking and drying of the skin over the breast. Some people may also have sores. And yes, it's like a wound around the breast that is unexplainable. So that's another. Um, Other things that can also be found in the breast, we find some people would have dimpling of the skin around the breast, or puckering. And this signs that are called dimpling and puckering are what you call peau d'orange. Is a terminology in medicine, peau d'orange, because the skin over the breast then looks like the covering of the surface of an orange. You see those dimpling and puckering of the, so we
Alright.
call it podiurge. That's another sign. So those are other symptoms. Then when we come to the nipple itself may be distorted. The shape may be distorted. So someone who has an everted nipple, a nipple that is out, may find that it turns in because something is pulling it in. So there may be a distortion of the nipple itself.
Hmm.
Another thing that may be also present is um, what you call discharge, nipple discharge, which can be colorless. It can be, it's not milk, certainly, if you're not breastfeeding. It can be bloody. Any form of discharge. Those are some of the signs. And it doesn't mean that when you have all of these signs, it means that it's breast cancer.
Yes.
It's just that some of these signs are associated. For some people as well, let me talk about pain, tenderness, pain. Usually, pain is not a typical symptom of breast cancer. However, if it is a pain that starts gradually and then it becomes worse over time, then it may be a pointer to something really serious that may be linked to breast cancer.
From this conversation and from what you submitted to us now, it would look first. It's not as if there isn't a lump in a breast.
Mhm.
So it now takes us to how do we now tell, to identify to say this is not the usual lump in the
Yes.
breast. So
Yes.
take us through how the individual now, the woman, or in the case of the 1% men, can identify this.
Okay. So to get to that, we need to know what the usual anatomy of the breast is. So we know that we have the rib cage, we know we have the intercostal muscles in between the rib cage, and then we have the muscles before we find the breast tissue. So we
Yes.
have the muscles. Then after the muscles, we have the fatty deposition around the breast. And that the fatty deposition means a lot because it's the difference between the size of the
Mm.
breast. Because the more fatty deposition you have in the breast, the bigger the breasts are. So we have that established. Then we now have the lobes and the lobules. The lobules are the milk producing tissues. Yes, let's say the milk producing tissues of the breast. And then we have the ducts, like I mentioned before, where after the milk is produced from the lobes and the lobules, it then goes to the ducts and then it comes out of the nipple. So and then we also have the connective tissues. So those are the normal anatomy of the breast. Now, if you were to just grab the breast like that,
Yes.
you would feel the hard, not so hard, but you will feel those tissues. You will probably feel the lobules. You will feel the fatty deposition, and maybe the ducts, depending on how what you are,
Okay.
how you are palpating or touching, the breast. Now, there's a technique, and that is why we talk about breast awareness.
Which brings us to awareness, the
Uh-huh.
techniques now we're
Yes.
about to get to. But I like the listener to know they can be part of this conversation. It's still about creating awareness. It's the month for breast cancer awareness, especially giving attention to our women, their reproductive health, and all of it. And also, the men are not left out. We'd like you to get your thoughts across as WhatsApp message onto 0809 4440981 would be where to send WhatsApp message. And we'd always would like to hear from you. If you've got questions for the professional, the specialist here, I've got Dr. Anne Olowu still with me. She will take the questions, but after this.
Grab a cup of coffee and chill. This is the smooth breakfast. Hey, listeners on Spotify, join in on the journey and listen to your favorite music without ad breaks. Upgrade to Spotify Premium now.
So when we
and
come
enjoy
back
4
after
months
this adverts go
free.
by,
Okay.
you
Thank you. So how is it? I hope it's okay.
that's just but don't you're okay. Just keep building, make your point, and just stay. You just see it as you're having a patient, and you are the one leading, and you're explaining, and the patient is just asking all the questions.
So I hope I'm not too slow.
No,
Voice
no,
is
it's
not too
that pace
low.
that would even make the message even sync properly that you're giving us. So just sustain it. Thank you.
I'm leaving this network and getting a glow SIM immediately. And I'm not giving you my new number. You're on probation. Why didn't you tell me about this new glow data plans?
Glow new data plans. Always bigger, always better.
Babe, sorry now.
Yes, get a Glow SIM card today and enjoy bigger, better data on the Glow network. Just dial *777# and choose your plan.
Okay, there's one message already relating to you already. Talking about those men who engage in building, bodybuilding and build their chest. So at some point we'll raise that question if
And it's good to talk about. So in this case, we may use this to talk about the myths of breast cancer. Some of the people, what they think is the cause of breast cancer, like people thinking antiperspirants.
when you get into close up the techniques for me, I'll link you up to this one.
Yes.
Then we'll
And
come
then
to
we'll
the yes. That'll work.
Hey, my people, how would I day? You know the times don't hard, but higher than Oku, don't they for Nigerian STEM? What a reliable fridge, freezer, or any other appliances, so...
Higher Temaku there for you.
What in our option where the last kakaraka, oh?
Higher Temaku there for you.
What in our appliance where they consume so much electricity, oh?
Higher Temaku there for you.
And now, higher than Oku don't land with another promo. What them call?
We there for you.
So now go this November 30th, 2023. If you buy anything from higher than Oku, then we'll serve you a roof on top. Aye! Free standing cooker, free microwave, free air fryer, free AC installation, and even more a roof day. For more to visit any authorized dealer or www.temuku.com.ng. Make yourself begin enjoy your own roof. Terms and conditions they do. Higher Temuku, always there for you.
Driving in Lagos traffic in the evenings can be such a... Enjoy all-round entertainment in the company of the smooth, dynamic maestros and let music be your therapy.
98.1, your love music, love life station.
It's your smooth drive home with soothing soul music, great spice of jazz, tuned toppings of rhythm and blues, and everything else radio-friendly that you enjoy. The Smooth Drive, every weekday from 4 p.m.
We're Smooth 98.1 FM. It's time to get into the more conversation relating to breast cancer awareness. As to God, the specialist here, Dr. Anne Olowu, still helping us break down all of the meat around it. But since the first time, this day was ever celebrated, that was way back in 1985 as a partnership between the American Cancer Society and Imperial Chemical Industries. I know there's been a whole lot of developments around fields of studies, but before we were going to make mention of techniques and ways of the woman especially should be able to feel for the lumps around the breast.
Yes, both females and males. There's not just the women.
Throw the men into it, to the 1%
Yes.
men.
Because you'd be surprised to know that you may be surprised to learn that some lumps are actually detected by the men, the husbands. They're the ones that tell them, I'm feeling something in your breast. I think there's need for concern here. You need to go. So it's also important that the men know how to. So we're talking about how to detect a lump in the breast.
Yeah.
Aside, we also talked about the things that you can see. So the first thing to do is to look at the breast. So to look at the breast and see, is there a change in size? We know that usually one breast is slightly bigger than the other. But beyond that normal thing, so we say breast awareness. When you know the normal of your breast, you are the first to know, when something is abnormal.
This isn't looking normal.
Yes, this isn't looking normal. So just by looking at the breast, there are things that we can see. Looking at the nipple before you then go on to touch. So we know in touching and in feeling, what are we looking at? So first thing, the technique, how we touch. We don't use, for those of us watching us on YouTube, don't know, we don't use the tip We don't use the tip of our finger, because when you use the tip of, then you are poking.
Mm.
All right. But when you use the flat of your hands and you place it flat on your chest, and then you go, so they are different. You can go round from inside out. You can start from the nipple area, your areola area, and you go round until you get to the chest wall, the outer part of the breast. Or you start from the chest wall up, down. And it's also important for me to mention that beyond the breast, we also have the lymph nodes. The lymph nodes are the nodes or the parts of the immune system or the lymphatic system that drains the breast. And so when there is something wrong in the breast,
Yes.
there may be symptoms in the lymph nodes. The lymph nodes may be enlarged. And for the breast, the lymph nodes that drain the breast are found on the chest wall, in the supraclavicular area, and the armpit. So when you are examining and you are touching, you are also checking from the chest wall, that is from your clavicle area down to all around the breast, and the
That goes
armpit.
under your armpit and that area.
Yes,
Yes.
the inside of the armpit.
Yes.
Why? Because if there is something happening in the breast, there is a likelihood that the lymph nodes may be enlarged. Remember, when you have the flu or you have a sore throat,
Yeah.
if you go to your doctor, they would usually put their hands under your chin. They are looking for lymph nodes, or behind your ears. If the lymph nodes are enlarged, it may be a sign, it's a sign of an infection. So it's the same thing with looking for lymph nodes around. So having said that, so we talked about going the circular motion, using the base, not the tip now, the flat part of your fingers, the four fingers, or I mean of whatever finger that you are dominant in. And then you go the circular motion, you go round. The essence is you go round flat on the chest. You shouldn't feel anything. The lobules are there, but they are flat on there because you are not grabbing them from out. But
Yes.
now you are going flat and you are going
That's against the chest. Like
yes, down on the
yes,
chest,
on the
and you are
chest.
going systematically, going round. If you are going through the circular motion or vertical motion, you go down and you go up. For even for people with big breasts, all you need to do is to lift the breast, press it down. It's not difficult. So if you do this at least once a month, you may do it more often until you are used to knowing how to do it. So if you do it every month, at least away from your menstrual period, that maybe 2 or 3 days after your menstrual, why do we say don't examine your breast? You can, but during the menstrual period, usually the women's breast is tender, so it may be painful, and then it also there is some swelling, really. So you it's so and then for people who have fibrous breasts, that's when it's a little exaggerated.
Fibrous. What do you mean with
So
fibrous breast?
so that some women have the breast tissue itself, the lobules itself, in some people is more enhanced than in
Okay.
some other people. Some people have more fatty breasts than fibrous breasts. And so that's the difference. So usually you shouldn't feel anything when you do this consistent. Now you do it on the right and you do it on the left. And don't forget, you also go checking your armpits and the upper part of the chest wall. You are not supposed to feel anything abnormal, maybe like a ball, because there are different types of masses. Even not all lumps seen or found in the breast are cancerous. Some of them are benign.
Okay.
But you don't know until further investigation.
When they're benign, it's not dangerous or harmful.
Yes, when it's benign, it means that it cannot spread, it cannot grow beyond the breast and cause and metastasize to other parts of the body. So
Okay.
usually when it is removed, it doesn't pose further danger.
Now, this examination you talked about, there was a point before it seemed like sometimes for some women, now for the married ones now,
Yes.
it looks like you said the men also should be able to know the breast and say, okay, I think I observe and
Yes.
call attention to it. And
Yes.
is there a place for also the man to also help in, feeling for it?
Yes, certainly. I mean, in a married man situation,
Yes.
I mean, the breast is always a center of attention, for men. And because they are the ones often touching it more than the females themselves that have the breast, they tend to, for someone who is sensitive and observant, they know that something is amiss. And that's why we are also advocating for women.
Yeah.
You be for yourself, be breast aware, know your body, touch your body, so you know when something is wrong, something is happening. Because you know why? Breast cancer is important. It is the most prevalent cancer.
Okay. I'd like to get the listener also. This is where we get you talking. Would also like you, if you've got question for the specialist here, Dr. Anne, speaking on breast cancer awareness and the health of the breast and what we can do for early detection. This is what starting from the home right now is what she's been speaking on. We'd like to hear from you on 01 448 9981 is where we like to get the calls coming from. So while we wait for the calls to come in on 01 448 9981, we see messages also would go to 0809 4440981. Now, there are myths around breast cancer. Before the advent of discoveries, science is making us understand more about what breast cancer is. But I'd like to tie that to a question that was raised by Saint Fat Joe, who sent us a message. He says, some men build their chest. Do men with such bulky chest have tendencies for breast cancer? Walk us through this one.
Okay, yes. So for men who build their chests, we should be made aware that it's muscle. Yeah, I believe. So for that, it's the bulk of the.
So muscles are not tissue, they're not tissues, right?
No, the muscles themselves are not the breast structure. They don't. They are not the lobules that develop in the women. They are not the ducts where the breastfeed the milk, for breastfeeding comes through.
Yes.
So even though they have the structures, it's very minute. That's why also it's very little. That's why they also are at risk. Men are also at risk for breast cancer. But for bodybuilders, it is the muscles. So it's the muscles around the breast. So
Okay.
the bodybuilding does not make you susceptible. It's not a risk factor
Okay.
for developing breast cancer. There are other risk factors.
Still speaking on more myths, what is not breast cancer?
Myths, okay,
Myths, yes.
myths around breast cancer. So there's the myth that first we've debunked one myth that says that it's only women that have breast cancer. We know that men also can get it. Now, some people believe that the use of antiperspirants can predispose, is what causes
Deodorant.
deodorants,
Yes.
yes, deodorants
Perfumes.
and antiperspirants
Mm.
that or perfumes, yeah, like you said, are the causes or some of the causes of breast cancer. But that has been debunked. Research has shown that our use of antiperspirants, does not um, cause or predispose you to developing breast cancer. That's one myth. Another myth, some people have said that, oh, if you, it's only people with a family history of
Mhm.
breast cancer that can have breast cancer. Now we know that people with a first degree relative, we call it first degree relative. That means that in your family, if your mother or your sister or you have a daughter who's had breast cancer, then there is a possibility that you also are at risk of developing breast cancer. Why? Because it means that the gene for breast cancer runs in the family. But we also know that more than 85% of people, or about 85% of people who have breast cancer, don't have any family history.
Okay.
We also know that there is something called breast cancer gene 1 and gene 2, called BRCA1 and BRCA2 genes, that some people, at least I think up to almost about 5 to 10% of people have, there's that gene. In those people with that gene mutation, they have a 72% to 69% risk, lifetime risk of breast cancer. But these are very, it's a small number of people, and you need to do some form of genetic testing, or if you know, if you have a family history of it, that those are the people who have a gene predisposition of having breast cancer.
I know there are still more myths you want to help us unpack, but
Yes.
that will be after this. So let's get the calls ready. When we come back on 01 448 9981, you've got questions relating to breast cancers. You want to speak to the specialist this morning. Dr. Anne Olowu is here to take your questions. And we also would like to read WhatsApp messages on 0809 4440981, but that will be after this.
It is said that there is no bond stronger than that between a mother and child. A bond made from trust, a deep emotional connection, and most of all, love. Now it is time to really test that theory in the most loving battle ever. Indomie Love Bowl, a brand new family game show
It's
on
so much to
African
talk
Magic.
about.
Yeah,
Watch
it's a lot,
mothers
it's
team
a
up with
whole
their
lot, but
children
then
to compete in a number
it's
of
engaging
exciting
and
games
it's
for
quite
prizes up to
it's okay.
20 million naira. Don't miss Indomie Love Bowl, hosted by Stephanie Koka and Darasimi Nadi. Experience family fun, excitement, and love all in one. Indomie Love Bowl, showing every Sunday at 7 p.m. on African Magic Family. Stay connected to DSTV or GoTV.
OneXBet is offering a mind-blowing hyper bonus. Get ready for a gaming experience like no other. Place an accumulator bet and watch your winnings soar with our 1000% bonus. That's right, 1000%. So what are you waiting for? Visit onexbet.ng today. Use promo code HYPERNIGERIA to get a 300% bonus up to 189,218 naira and take advantage of the hyper bonus from OneXBet.
Make your payments contactless with MasterCard. You can tap, scan, or pay by link. No more fumbling.
So we're due in less than a second. We're coming back now.
Gives you 5 gigabytes and 30 gigabytes instantly. Hurry to the nearest Airtel shop or visit www.airtel.com.ng/HBB to get started. Airtel, a reason to imagine.
Welcome to Smooth Breakfast. Hello, everyone. This is your favorite Nigerian soul singer, Maka, and you're listening to the Smooth Breakfast.
On Smooth 98.1.
We're smooth, 98.1 FM. It's gone exactly 27 minutes before we hit the 10 o'clock mark, and it's still Lagos Talks 981. I still got Dr. Anne Olowu still helping us understand all we need to know about breast cancer, and most importantly, this idea of saying it's just about the women, leave them alone. It's not men. Men, we've been told, of course, you can even see that you've got breasts, and the professional here, Dr. Anna, said there's been cases of about a percentage of men also in terms of the data are coming down with breast cancer. But you were speaking about some of those myths we were trying to debunk before we went. So you can continue.
Yeah, so we talked about the genetic factor,
Yes.
and we said that more than 85% of people, even though there is a genetic predisposition and then the first degree relative risk, we know that more than 85% of people who have had breast cancer do not have any genetic predisposition. And that's why it's important that we know that breast cancer is not restricted to people alone who have a genetic risk factor or family history. And then we've also heard people say that that it's only people who have had a lump before, or that if you've had a lump removed from the breast, that you cannot get breast cancer. And that is not true. You know, like I said, there are different types of lumps. There are different types of masses. So a person may have found a lump in their breast that may have been removed in the past. It doesn't mean that you then are not breast aware. You don't do the needful of checking your breast every time and doing the necessary thing to continue to ensure that you are healthy and that there are no cancers or any sign of cancers in the breast. So we need to also be aware of that.
Then there is also this myth around now, which is the reason that explains why it said the wearing of bra lately
Yes.
by women seem
Yes.
to be on the decline. So speak to us also about what's the relationship between wearing bras and cancer, with the woman.
Yes, excellent. Yeah, because that is another myth, that the use of bras, or most often than not, the use of underwire bras. Yeah, some women call it cosplay bras. Those bras are held to push up and give a firmer look of the breast, like those ones. And the idea behind that is they thinking that it restricts the flow of blood, or the lymphatic drainage in the
Yes.
breast. But it's also been debunked. I think that the not use of bra is more related to how uncomfortable it is.
Okay.
It's like some type of contraption, so it's not always convenient, yeah.
Because lately
But
now there is a World No Bra Day as it is right now, celebrate, which is a day where people just walk around and they say they
yes,
don't no bra
yes,
having it
no
on.
bra is more for comfort, really.
Okay.
It has more to do with comfort and almost nothing to do with breast cancer. It is not a known risk factor for breast cancer.
I'd like you to also help us eliminate this myth that's out there about X-rays and how it exposes people to cancer. Speak to that.
Yes, so X-rays are a good one because even when we get to when we're talking about um, how to some of the prevention methods
Mhm.
that we use for breast cancer, you will find that mammograms are an X-ray of the breast.
Yes.
Okay, so it helps us to see what is going on inside there. And so even for me, when I started to do mammograms, I was
Yes.
concerned, for the fact that, oh, this is an X-ray, we're not supposed to. And my radiologist assured me, he said that the rays that you get, from a mammogram or even the X-rays, the usual ones, that it's really minute
Okay.
and you don't get it often. He says if you are a frequent traveler, that the rays that you get, on the plane, traveling in the air, you are more exposed, to rays that are unhealthy for you in comparison to radiological X-rays. So they are really minimal and they would most likely cause very little damage. That is not to say that you should not avoid exposing yourself to rays and X-rays. It is when it is necessary. But we've also been assured and know that the level of it is really minute for it to damage.
Now this takes us to lifestyle. What's the place of lifestyle in the, a patient or a woman eventually reporting, falling to cancer, or even a man?
Exactly, yeah. Because when you say women, I'm like,
I'll quickly balance it out. That's why I just quickly, I would,
both men and
no, I will
female.
quickly always throw that in. Yes,
So
men.
we have things that we call, first, before we talk about just lifestyle, there are two things that are risk factors. Two broad sections of risk factors. We have the modifiable risk factors
Yes.
and the non-modifiable risk factors. The non-modifiable risk factors are the things that you can't change. You can't change being genetically female. That is the number one risk factor for breast cancer. And two, getting older. Why? Because as we grow older, we remember when we talked about cancers and the
Cells.
origin of it, it's the cells. We always regenerate cells. So the older you are, the more there is cell regeneration. And so older age is a predisposing factor that you cannot change. We all want to grow older and grow older. So those are things that you cannot change. Now, the things that you can change, which then brings us to the risk factors that we can prevent. Number one of them is smoking. Quit smoking. Smoking of cigarettes, shisha, whatever it is that you're smoking, even vaping. Those things, because they contain toxins that are unhealthy for the body, that can cause cell damage. It then predisposes to not only breast cancer, but all the types of cancers and other types of illnesses, hypertension, diabetes, all of those things. So smoking first. Then alcohol intake. Excessive alcohol intake is likely to also damage the tissues and the cells to some degree. And so ensuring that you're limiting your alcohol intake to the recommended daily dose. And moving on, we talk about lifestyle modification. We know that obesity is one of the risk factors in cancer and a lot of other diseases, But obesity, when it comes to predisposing one to breast cancer, it usually is associated with weight gain after the age of 18, but more specifically weight gain, especially after menopause. We know that during the menopausal years, we don't have estrogen and progesterone being secreted by the ovaries. However, during menopause, most of the estrogen that is secreted by the body are from the fat cells. So the more weight that you gain, the more likelihood that there is secretion of estrogen from these fat cells. And those excessive hormones can predispose people to breast cancer. So those are some of the risk factors.
That
you
leads
can
me, because I would also just go back to a point you made. You talked about the need for people to do self-examination of the breast.
Yes.
The woman can do that alone,
Yes.
as well as getting, if she's married, the husband can also be of good assistance to help do
Yes.
the self-examination to
Yes.
find that out. But take us through the mammogram. How often should women go now to the hospital? Because she's done the feeling the
Self-breast
self
examination.
at home, and then
Yes.
she's just fine.
Yes. So these are the things that we recommend for detection, early detection or investigations. First, the self-breast examination, which we talked about that ideally you should do once every month.
Yes.
Yeah. It really doesn't have to be once every month, but for you to remember, to know that it's something that is consistent, so we recommend doing it once every month. Then there's the clinical breast examination. A clinical breast examination is when you go to the hospital and then you have your physician, your doctor, or your nurse, or your health provider help you also examine your breast, because techniques vary. So your doctor or your physician would also be helpful in ensuring that it's done thoroughly. So every time you go to the hospital, ensure to have a clinical breast examination. It's just them doing what you do for yourself, but then you now have a professional double checking on you. Now, when we come to the mammogram, mammograms are x-rays of the breast. It is recommended that from the age of 40, you start to do a mammogram once every 2 years. And then by age of 45, every year. Why? Because we know that from age 40, but more specifically from age 45, the risk of breast cancer, it increases. Remember we talked about old age being,
Yes.
obesity
and all that, estrogen
yes,
secretion.
yes. So we talked about old age being a risk factor, and so the older you get, and in this case, from statistics, it's been saying that it's higher, from that age, and so we recommend that every year, at least once every year, you have a mammogram done for a female. However, for people who have a family history of breast cancer,
Yes.
first degree relative, like we mentioned, mother, daughter, sister, it's recommended that you may have to start doing mammograms earlier. So depending on your physician may recommend that you start it maybe at age 30 or age 35. And this is also dependent on the age of diagnosis of your first degree relative.
Okay, worst case scenario, this is what everybody, first, let's get this. Is cancer of the breast a death sentence?
Absolutely not. That is why we are here. That's why we're talking about awareness. We know that breast cancer of the breast is the most prevalent cancer in the world. When you remove non-melanoma skin cancers, when you remove the non-melanoma skin cancers, breast cancer is the most prevalent cancer in the world. It is the commonest cancer as well. Yeah, for new cases in the world, new cases of cancers, breast cancer is number one. Now, in Nigeria, it is also the most prevalent cancer in the world. That is amongst both male and female cancers now. Even worldwide, it's the number one. And also the most common of all cancers in Nigeria as well, male and female cancers, is breast cancer. Now, the highest cause of cancer deaths in Nigeria is breast cancer. And the second highest cause of cancer deaths in the world is breast cancer. That's why awareness is really important, because when we know,
is there a race you look at? Do we see a place where race predisposes people to breast cancer?
For in the US, really, for what they have discovered is not that the black people are more predisposed to breast cancer, but they are more predisposed to dying from breast cancer. And this is because of early detection. Right, and access to early detection and treatment. That's the difference. And that is why we talked about awareness. That's why awareness is important. Because the earlier you know and you do something, then the the better you are at preventing deaths from breast cancer.
Okay, so we are at the final stretch of this conversation and we'll be getting into treatment and management when we come back. So, but that will be after this. So, if there's still a question out there, 014489981 or leave us a message on 0809444091. We are Smooth 98.1 FM.
Thank you.
Welcome. So when we come back now, treatment lecture, management.
The title of Slum King is reserved only for the chosen.
But I still find out that people are still generally, as we're still very shy as a society, we don't want to talk about breast cancer or the female reproductive system because we just feel there's a certain line that is cultural, you shouldn't be crossed, and people want to talk, but they're just so shy to talk about it.
So when people talk about it in their little
Clusters, yes. Well, why can't we talk? So, okay, for example, see, that's why I'm going to close with this guy's message. He says, "Oh, I can feel your pain all the way from here. I'm listening to you." So there are many persons who are just rapt listening at, "Oh, so it's possible for a man and a woman to talk about this conversation, and it can be this way." I mean, you understand what I'm trying to say? That's what it is. Like, oh, it's an awareness already. Like, okay, they never saw it from this. They just believe it's breast cancer. Oh, it has to be a woman, and a woman must be able to talk about it. So there's this stereotype thing about where we boxed ourselves
It's really a
into.
fantastic idea that it's
Sort of, yeah. So
Heritage, harness our power, and unlock our potential at ArtX Lagos. Get your tickets on artxlagos.com now. ArtX Lagos is proudly sponsored by Access Holdings, Afrexim Bank, Stanbic IBTC Pension Managers, Chapel Hill Denham, ANAP Jets, DSTV Nigeria, Trace TV, Smooth FM, The Africa Report, and Beat FM.
What can you say about your finances? Let's talk about it, shall we?
please close the door if there's going to be noise here.
What can I say about money?
People don't really like to talk about money. Or do they?
It's extremely complicated.
I think everyone worries about not having money and being broke.
We make money, we spend money.
More people complain about money while the rich discuss money.
It's a rich man's world.
Well, for me, my dad invested in businesses, and that's how I started to learn about money.
And as we enter into the workforce, it really becomes you versus the economy.
Then you realize there's little or no money to save,
Even though you work hard for it.
So that's why every kobo you earn needs to be stretched as far as it can go.
But
sadly,
nowadays, we no longer spend in kobo.
especially when it comes to matching up against the dollar.
Now let's discuss your finances and simplify its principles for you. Tune in to Personal Finance on Smooth 98.1 every Wednesday from 5:15 p.m.
We're Smooth 98.1 FM. It's gone 10 minutes before it is 10 o'clock, and we're gradually heading to the home stretch of this conversation. Lagos Talks 981, still all about Breast Cancer Awareness Month, and we've got a guest who's breaking it down bit by bit, blow by blow, and you can say you were not in this class to get all of this understanding this morning. And Dr. Anne Olowu, so we are just going to go straight into management treatment at this time. But then there's this prestige. Yes, it is a Ghanaian proverb. It is said, it is because it is precious. That's why when she runs, she cups them in her hands. That's what it said. But I'm saying this to bring to mind that first, when we begin to talk about treatment, there's what it is said that the choices available makes it like the breast is that, look, integral part of the female anatomy, and treatment makes it like they have to make a choice to do away with it or keep it, or and then the life threat to it.
So when it comes to treatment of breast cancer, there are different options for treatment. And what determines the different options for treatment, apart from also the patient's, acceptance and what and what's the predisposition or their preference, the type of tumor, the stage of the tumor or the stage of the cancer determines the type of tumor. Now, there are different stages for breast cancer, but the one that I will make mention for us to understand is the TNM classification, TNM. T stands for the size of the tumor. N stands for the lymph nodes N. It stands for the lymph nodes involvement and what degree of lymph node involvement. And M stands for metastasis. Now, for metastasis, there is 0 to 1. 0 is no metastasis, 1 is metastasis. For the lymph node involvement, 0 is no lymph node involvement, 2 all the way to how many that would stage for 1, for 2, and for 3. And then the tumor size, is it less than 2 centimeters? Is it more than 2 centimeters? Where is it attached to the chest wall or not? These are the staging or the classes and the type. So that's one. Then we also have the type of cancer that it is. There are different types of cancers, and some of them, I don't want to drop names down, those are not the important things, but some of them are more aggressive and difficult to treat than some others. So the earlier a cancer is detected, in this instance breast cancer is detected, the more options that you have for treatment. And so a lower staging of breast cancer, for instance, a tumor that is small, that has not spread to the lymph nodes, that is not attached to the walls, your doctor may offer you just removal of that tumor, called a lumpectomy, or partial mastectomy, which is partial removal of those bad tissues and some of the tissues around that area. So that is an option. Another option is total mastectomy. That is full removal, surgical removal of the breast, because they've seen that the cancer has affected too many cells or tissues around the breast.
Now, that's the image that most persons, women, have whenever you want to talk to them about treatment. They always feel like, oh, so it means I would lose my breast.
No, that is not the case in all instances. I've just told us that. So there are different levels depending on how bad the cancer has entered. And so when you find it early, the treatment is less invasive. So there is the surgical treatment. And don't forget that now there is reconstruction. Women who have had their breast removed can immediately or soon after have reconstructed breasts, I mean, there's been cases of people who didn't have cancer, but because they have the BRCA gene, factor gene in them, they remove the whole breast and then they remove the whole ovaries and they have a reconstruction done. So there's that option. Now there are other treatments as well. We have the radiotherapy, we have chemotherapy, we have hormone therapy, we have monoclonal antibodies. So there are a varied options of treatments.
But all of these, they've got side effects too, and that's another scary part of what when you begin to talk about treatment to people when they come up.
Yes, we know that there are side effects. I mean, to everything that you take, even paracetamol has side effects.
Okay.
Right. So, but we know that the option of not treating is worse off than the option of treating.
So I guess I wish we could just continue, breaking all of this down, but this is not going to be the end of the conversation. It's just supposed to be ongoing to get this awareness across to people. And from all you've said, if someone is listening, you've seen that the statement today is not like a life sentence. There is hope for people out there.
There is.
In addition to the survivors out there, we just want to say thumbs up to them as they're shining lights to show that there is hope also.
Yes, there is hope, and that early detection actually does save lives, and there is hope. Breast cancer is not a death sentence.
All right, so I'll throw in a message from Ian as we close up this morning, and it comes up for me quickly, and it says, Omas, I can feel your pain. I don't know what pain you were talking about, but it goes on all the way from here. I'm listening to you. Thanks. They're all of them in that same WhatsApp group, all listening with rapt attention. But send a question. No, they want me to ask all. I've done that for you guys for free. So let's go on. And then it goes, women go through a lot. I hope God helps us find a permanent cure to
Amen.
this cancer thing someday soon. I appreciate the guest in the studio. I mean, honestly, the way she's done it, I don't know. It's like infant meal. That's how she's just breaking it down. Very detailed and useful information she's reading out. God bless us all, Ian. Thank you so much. And to Dr. Anne Olowu, thank you so much for your time. We
My
appreciate
pleasure.
you.
Thank you for having me.
And the final word to the healthcare givers out there, let's remember the woman's health is humanity's health. Let's make sure we keep them healthy. My name is Omatseye Atsenuwa. Oluwaseun Olusegun will be here for Strictly Soul, and Ayo and Joy would also be here for the Drive Time show. Stay tuned. Have a great day.
We know you're listening in on this frequency.
Thank you.
We are.
It's not a question of clear signal. It's not a question of quality sound.